Hello friends, welcome back to Dr. Jaggi's Academy. In previous lecture, I discussed about the diseases of the STD, that is gonorrhea and chlamydia. So in today's lecture, I will discuss the remaining diseases related to STD, that is genital herpes simplex, Chancroid, trichomoniasis and genital warts. So let's start. So as I told, in this today's video, I will discuss about the genital herpes simplex, Chancroid, trichomoniasis and genital warts. So I will discuss one by one. So let's begin. So first of all, coming down to the genital herpes simplex. So the microorganism for this genital herpes is actually a virus. And in short it is called as HSV. HSV means herpes simplex virus, which is of two types, type 1 and type 2. So as I told, it is a virus. And humans are the only, you can say, the reservoir for the HSV. It cannot live in other organisms, only in the humans. So now coming down to the some points related to the infection, you can say it is one of the most common infections in the genital region in the Western world, not throughout the world, but Western world, one of the most common infections in the genital region. So now, as I told, there are two types of herpes simplex. Herpes simplex 1 mainly causes the infection in the oropharyngeal regions, okay, in the mouth and the pharynx region. And HSV2 is mainly responsible for the genital disease, but this is a general trend. But both the viruses can both infection at both anatomic site, okay. But there is a preference for HSV2 for the genital disease. Now coming down to the pathophysiology, which I want to describe. So let's say the person is exposed to herpes simplex virus, and the incubation period is approximately 2 to 14 days. So when the bacteria enters, the first time kind of the symptoms that appear, they are called as first episodic infection. Symptoms arising due to first episodic infections. So what will happen? So now it is characterized by painful lesions on the genitalia. That means on the genital region there are small pustules which are formed, small lesions are formed, and those lesions are very, very painful. Then there are systemic symptoms also. That means throughout the body, some symptoms like fever will be there, headache will be there, some cold-like conditions will be there. And they are very severe in nature. Then you can say these symptoms will disappear, there is a healing, fever will subside, lesions will heal down, but this healing is not permanent. There may be a case of a relapse. That means there can be a second or third episodic infections, but the second and third episodic infections, they have the mild symptoms. So there is a first episodic or there are recurrent infections. So what are the clinical presentations? As I told in the previous one, I am just writing here. So it is having a short incubation period, 2 to 14 days. You can say average of the 4 days. Then you can have manifestations in two forms: first episodic infections or the second infection, second or tertiary episodic infections, which are called as recurrent again and again. So first of all, coming down to the first episodic infections, appearance of symptoms for the first time, and they are more severe in nature, and it is characterized by many painful, very painful pustular, like pustules or ulcerative lesions on the external genitalia. It is self-explanatory word. And then flu-like symptoms, as I told, fever, cold, headache, these kind of symptoms. And symptoms are more severe in females and the persons who are immunocompromised, that means persons having the low immunity. Okay, so this is about the first episodic infections. Now coming down to the recurrent infections, second or third episodic. Though these recurrent cases come due to relapse. Relapse means virus remains in the body, though the symptoms are not there, but still the virus is not totally eliminated, and this virus is reactivated again to cause recurrent infections. But symptoms are relatively similar, but they are relatively mild in nature, and lesions heal more rapidly. So this is what I want to discuss about the genital herpes. Coming down to the second disease of today's video, that is Chancroid. The microorganism is a bacteria, and it is gram negative in nature, and it is streptobacillus. Because of the shape it is called as streptobacillus, and the name is Haemophilus ducreyi. As I told, streptobacillus. Streptobacillus means this is a bacilli which is arranged in the form of the chain. Bacilli arranged in the form of the chain, streptobacillus. So this is the microorganism that causes the chancroid. Coming down about the disease. Now this is one of the most important causes of genital disease in the African countries or the Asian people. Compare, herpes simplex were more common in the Western people, but the chancroid more common in the African or the Asian country, or you can say the places where there is a poor socio-economic group, or you are the persons who are poor in nature and they are not living in a good conditions. So you can say those kind of a people. Now coming down about the symptoms. Again there is a ulcers, and they are acute in nature. And what kind of ulcer? We use a word as a name, chancroid. So the name is obtained because of this word chancre. Chancre means a ulcer which is present on the external genitalia. Because it is an ulcer, sometimes it is also called as genital ulcer. So I am repeating, ulcer, chancre on the external genitalia. And the characteristic feature, as I am telling, it is painful in nature. So now I am saying two words. In the chancroid, the ulcer is soft in nature. Soft means if you touch it, then painful. So why I am mentioning these two things? Because we discussed chancre already in the syphilis. In the primary syphilis, there is a chancre, but that chancre is hard in nature, and that chancre is painless. So hardless, painless chancre in the primary syphilis, but soft chancre and painful in the chancroid. So this is how you can differentiate two diseases, primary syphilis and the chancroid. So more about the symptoms. The symptoms are mainly local, that is located on the genital region. No systemic manifestations, no fever, no cold, these kind of things. And if you talk about the males, this ulcer can be solitary, that is, it can be single ulcer. But in case of females, the number of ulcers can be many. It can be 3, it can be 4 ulcers in females. So now coming down to the next disease of today's video, that is genital warts. So microorganism is a virus. It is called as human papilloma virus, HPV, human papilloma virus. So now symptoms. Wart, actually we use the word wart. Wart means extra growth on a skin. So similarly, extra growth on a skin in a genital region is called as genital warts. So this is what I want to describe. Soft, not very hard, soft overgrowth, skin overgrowth, extra growth actually you can say, on the external genitalia, that is a wart. And if you see under the little with the magnification, this overgrowth, extra growth can be seen, can be in a shape of a cauliflower. And if you touch it, how you can see there is a normal skin, but this extra growth can be seen if you just slightly touch it, and you feel it is slightly bumpy when you touch it. And it equally affects male and females, and the warts can be single wart or clusters. Many warts may be there, or it may be a solitary one. And this skin growth, extra growth, may be painful in nature. It can be discomfort, or it can lead to the itching. And particularly, this is important thing, in women, if there is a wart, there is a human papilloma virus, then it is an important cause of the cancer of cervix or the uvula. So human papilloma virus. So this is a dangerous thing that has to be taken care of. So now coming to the last disease of today's video, that is trichomoniasis. Trichomoniasis is this kind of a shape is there. Trichomoniasis caused by Trichomonas vaginalis. It is a parasite. So more about the disease. It is more common in females, in the women, as compared to in the males. So this incubation period is 5 to 28 days. The symptoms: itching in the genital region, burning during the urination, abnormal discharge from the vaginal region, and this vaginal discharge is yellowish green in color, and it is frothy, some bubbles, froth like thing, and it is bad smelling. And important thing, if the persons are suffering from this trichomoniasis, they have more chances of development of HIV or AIDS. So this is what I wanted to discuss about the 4 diseases of STD. In the upcoming video, I will discuss about the HIV, AIDS, its pathogenesis, symptoms, and the opportunistic infections. Thank you.